Hi, my name is Colin Baker. I'm a current fourth year medical student and former research fellow at the Rothman Orthopedic Institute. I'm honored to have the opportunity to discuss our jbjs article titled Hyponatremia is an Overlooked Sign of Trouble Following Total Joint Arthroplasty. During my research fellowship, the senior author for the study had mentioned that they had a few patients undergoing hip and knee arthroplasty who developed hyponatremia and ultimately stayed in the hospital longer than expected. Because of this, we decided to review the literature and found a relative lack of studies examining the impact that hyponatremia has on the perioperative course for these patients. So, with this in mind, we decided to conduct a retrospective review of 3,071 patients who underwent either primary or revision total hip and knee arthroplasty. And all of these individuals had at least one preoperative and one postoperative serum sodium value obtained. Some interesting findings that we saw were that individuals who were hyponatremic both pre and postoperatively had the worst outcomes. They had a greater hospital length of stay. They were more likely to experience in-hospital complications, and they're also more likely to be discharged to either a skilled nursing facility or a rehab center. These findings were consistent in both primary and revision cases, and also the association with worse outcomes in hyponatremia remained true while controlling for confounding variables. Another interesting thing we saw was that the severity of the sodium disturbance, meaning the lower the postoperative sodium value was, the worse the outcomes were as well. We did run some challenges while conducting this study, one being we were unable to determine what the etiology of these electrolyte disturbances were for individuals who did develop hyponatremia. That's something that further research could certainly be beneficial in finding and answering for these patients. As far as its impact on practice, I think we know recently there have been several studies that demonstrate that routine laboratory testing is not necessary for all arthroplasty patients, and the findings from this study certainly don't dispute findings from the previous studies on the topic. However, I think the findings from this study do suggest that if routine labs or if electrolyte panels are being ordered, that hyponatremia may be beneficial in indicating a patient with a low physiologic reserve and also identifying patients who may be at risk for a poor outcome. Ultimately, the big question that needs to be answered moving forward that we were unable to answer in this study is what interventions, if any, can be implemented to improve the outcomes for these patients. Thank you again for the opportunity to discuss our article.